Okay, let's go to our next caller from the 607 area code. Caller from 607, please enlighten us with your name, where you're calling from, and what you want to ask about today.
Hello, this is Caleb from New York, and I have a question about the Senate GOP healthcare bill.
Okay.
Do you think it will pass by the end of the year? And what do you think of the Ted Cruz, Mike Lee amendment?
I don't know about the Ted Cruz, Mike Lee event. What's that?
It's a proposal by those two senators that private health insurance companies may sell a insurance that doesn't meet the Obamacare standards, as long as they have one insurance program that allows them to meet the ACA standards.
Oh, okay. Yeah, I haven't heard about that. I'll look into it. I guess I don't. Let me comment on the first part because I think that that's the really important part. There's every indication that version 2 of the Senate version of the American Health Care Act is dead, and we were talking earlier this week, Pat, about how there's really only a couple weeks before the August recess.
But now Mitch McConnell plans to eliminate the first 2 weeks of that recess.
I did read that. Yeah, I would wait before I fully believe that they're actually going to miss half of their vacation. I think that if it doesn't pass before the August recess, that they are going to likely have to do something drastically different. I still do think it's very possible that something will be passed before the end of the year, but will it really in spirit represent a repeal and replacement of the Affordable Care Act? I don't know. I'm very skeptical.
And what does that tell you? That in August they'll have to go back home to their constituents and give these town hall appearances where they have to explain why they're going to vote for this American Health Care Act. And the idea that they're not really willing to do that and they know that it's not going to be good for them really demonstrates how horrible this bill is.
And the problem, Caleb, is that, Republicans have been promising that they would repeal Obamacare and that the replacement would lower costs, increase access, and increase quality of care. You cannot do that. That is not doable by moving Obamacare to the right because Obamacare is already right-wing. So I think that if they pass something before the end of the year, which is not unlikely, it is not going to actually be a moving to the right from Obamacare in any substantive way.
Okay. Thank you for taking my call.
All right. Thanks, Caleb. Very much appreciate it.